Do you want to know? Well, I've been thinking about you, and I think I have to listen, because the sun is up, it's beautiful.
You're welcome back to my channel. This is Paji Empire Gender Selection. So if you are new in my channel, this channel is all about sexual health, relationship, marriages, lifestyle issues. So today I want to talk about cervical cancer screening. I know so many women out there do not find it necessary to go for a cervical cancer screening. Well, I'm telling you right now that it is very, very necessary. As far as you have been exposed to sexual intercourse, if you have a cervix, you are at high risk. Even if you already have the vaccine to immunize you against this, you are still at high risk. So in this video, I'm gonna be sharing with you a little bit of my knowledge on this, so stay tuned and keep watching. What is cervical screening? So I'm gonna be explaining what it's all about. So a sample of cell is collected from the cervix. The cervix is the neck of the womb. So this sample of cells are collected and checked under a microscope for abnormalities. Why doing this checking? Also, these cells are also checked for human papilloma virus. Now, these human papilloma viruses, there are different types. So we have a certain kind of human papillovirus that can expose you to cervical cancer, if not now, but in future. And when this kind of virus is seen in the cervix, people with this are being treated, and also monitored regularly, from time to time, maybe after every 3 years. Here is done every 3 years, sometimes every 5 years, just to check, to make sure there are no abnormal changes, because those cells, they cause abnormal changes in the cervix. So right now, I want to tell you the people who are at high risk. I'm not going to make this video very long. So the high risk people are people with multiple sexual partners. High risk is also based on age. As you advance in age, you should be going for the screening. Then even if you've had this vaccine, like I mentioned in my introduction, even if you've had this vaccine to cover you up for this cervical cancer, you are still at a high risk. You still need to be going for cervical cancer screening. You are also at high risk if you've had any skin to skin contact with the genital areas, the VJJ, you do oral sex, not just only penetrative sex. You are at high risk of HPV, which is the human papilloma virus that can lead to cervical cancer. So you've had any skin to skin contact with the genital areas, like the anal sex, and then if you share sex toys, you are also at high risk. Signs and symptoms of cervical cancer. are pain during intercourse, bleeding after intercourse, some kind of VJJ discharge, unexplained discharge, that also uncontrollable discharge, then you need to get to the hospital as quickly as possible, because cervical cancer is really deadly. Why I say it's deadly is because it cannot give you a sign like that, as in it's not really easily detected if you don't go for test. Not like the breast cancer that you detect through lump, that the cervix is hidden, it's not seen. However, most people can get human papilloma virus at some stage in their lives, but it's not something you should get embarrassed. So I urge you to go for cervical screening to save your life and your future. So guys, if you enjoyed this video, please give this video a thumbs up, subscribe to my YouTube channel, turn on your notification bell. I will see you guys in my next video. Bye.